Thank you, Madam Chair and Ranking Member Burr. I want to thank all the witnesses, too, for being here today and for your work. I want to start with a question to Assistant Secretary O'Connell. Last month, I sent a letter to Health and Human Services Secretary Becerra highlighting the difficulty that some Granite Staters have faced in accessing COVID-19 rapid tests and urging the Secretary to take action. These tests are essential tools to help ensure that people can stay safe, kids can stay in school, and we can keep our economy open. So, Assistant Secretary O'Connell, what will the department do to address the issues raised by my constituents in New Hampshire about access to COVID-19 rapid tests?
Senator Hassan, thank you so much for the question, and of course, thank you for the letter. Your letter raised two key points. One, the amount of time it was taking for some of your constituents to get the results, and the other was the lack of the over-the-counter tests in New Hampshire. So we responded to both. The ASPR testing team reached out to the state health official to understand the delay and learned that the average turnaround time right now is about 1.1 days, though it sounds like your constituents had some different experiences. We'll continue to watch that. The second issue was about the lack of over-the-counter tests. The team reached out to Abbott, and they have now secured the 60,000 tests that New Hampshire has ordered. They will come in 10,000 increments for 6 weeks, so you should have 60,000 tests in New Hampshire by Christmas.
Thank you very much. I appreciate that. I know my constituents do too, especially parents of school-aged children who want to get those results quickly so the kids can get back into the classroom. Dr. Fauci, as I think probably some colleagues have already noted, but I wanted to talk about the availability of vaccines for younger children. I think all families in New Hampshire were relieved when the Food and Drug Administration and the Centers for Disease Control signed off on Pfizer's COVID vaccine for children ages 5 to 11 last week. At a hearing earlier this year, I asked when you anticipated that vaccines would be available for children of all ages, and you told me that you thought vaccines would be ready for children of any age by the end of the year. Do you still anticipate that vaccines will be available for children under age 5 by the end of the year?
I don't know. When you say available, Senator, that's the difference between the clinical studies that are done to show the data. Currently, as we are speaking now, the age de-escalation studies are part of a spectrum. One of the spectrum was what you just heard of, 5 to 11. The data were convincing. You've heard of the results from Drs. Woodcock and Dr. Walensky. The studies are ongoing now from 6 months up to 2 years, 2 years to 5 years.
Right.
I would anticipate, I would have hoped that the data might be available by the end of the year. I would say, and again, it's very difficult to make predictions because you don't want to get ahead of the data and you don't want to get ahead of the FDA's analysis.
But you're thinking, I'm just trying to get a sense of timeline.
Yeah, I would think it might be towards the beginning of the coming year or the end of this year, I hope.
Thank you very much. Dr. Woodcock, I wanted to shift to another issue because, of course, while we're dealing with the pandemic, we also continue to deal with the opioid epidemic. I recently sent you a bipartisan letter about the consulting firm McKinsey, which simultaneously worked for both opioid manufacturers such as Purdue Pharma and for the FDA on a variety of projects, including a track and trace system to monitor dangerous prescription drugs. The FDA response to my letter stated that McKinsey never disclosed these potential conflicts of interest and that the FDA only learned about them earlier this year, nearly a decade later, through media reports. McKinsey's work for Purdue Pharma was made public in a major news story last year, and McKinsey issued a public apology for its actions last year as well. So why wasn't the FDA aware of McKinsey's work for Purdue last year when it was front page news and McKinsey was speaking publicly about it?
Well, at least speaking for myself, I was aware of that. At that time, McKinsey was only doing consulting work of an administrative nature for the FDA. And so there was nothing that had to do with any product or any standard or anything like that. It had
Doctor, I'm sorry to interrupt, but I'm almost out of time. I just want to point out that they were consulting on a track and trace system to monitor dangerous prescription drugs. that your response to my letter also says that since finding out about McKinsey's work for Purdue, quote, no additional contract reviews or outreach to McKinsey has occurred. So I will, because my time is about to, or has expired, I will follow up with you and the FDA. It seems to me we have a major conflict of interest between McKinsey's work for McKesson and Purdue at the same time it was working for the FDA on track and trace system, and it's something we really have to get to the bottom of it because I think it helped fuel the opioid epidemic, which has devastated my state. Thank you, Madam Chair.
Happy to work with you.